When to seek fertility support. The aim of this video is to give some guidance in when to seek medical advice and what to expect from a fertility assessment. Hi, I'm Dr. Yusuf Al-Yusuf, a fertility specialist. If you've been trying to conceive without success, you're not alone. 1 in 6 couples in Australia experience fertility challenges. Today, I'll explain when to seek help and what to expect from a fertility assessment. If the female partner is under 35 years old, speak to your GP if you've been trying to conceive for 12 months. However, if the female partner is over 35, we suggest that you seek help after 6 months of trying, because age is a factor and time is of the essence. Early engagement is especially important if you have irregular periods, if you know that you have some fertility challenges, such as low sperm count, low movement, or a history of recurrent miscarriages. And you might ask, what should you expect from a fertility visit? For women, this might involve doing some prenatal testing, such as infection screen, as well as hormonal testing, which usually includes an AMH test or anti-Müllerian hormone. This is to assess your egg reserve. It would also involve a gynecological ultrasound. This will check the uterus and ovaries and will also give us an indication about your egg reserve by counting how many resting eggs we can see on your ovaries. And for men, usually this will include a semen analysis to evaluate the sperm count, motility, and morphology. There will also be some blood tests, such as an infection screen. And your GP or fertility specialist might also discuss some lifestyle factors that can affect the quality of sperm or eggs. And for both partners, you can consider having a genetic carrier screening done. This is an optional test and it will assess your chances of passing on a genetic condition to your child. There is more to this test, and I suggest that you discuss this further with your doctor. If you are referred to a fertility specialist, they may perform extra additional tests, such as advanced imaging, including tubal patency test, and extra hormonal tests, especially if you have irregular cycles. They may also order some genetic testing, depending on your circumstances, especially if you have personal or family history of genetic conditions. The specialist would ultimately work with you to create a more personalized plan. This may include lifestyle changes, ovulation induction, or assisted reproductive techniques, such as IUI or intrauterine insemination, or IVF, sometimes called test tube babies. And finally, fertility challenges can be difficult, but you're not alone. Early support and guidance can make a big difference. Let's be proactive about our fertility. Speak with your GP for a referral to a trusted fertility specialist if you have concerns. Take care, and we wish you the best on your journey.